Mobile Stroke Unit. By the conclusion of this e-learning, you will be able to understand what the mobile stroke unit is and its importance to the community, comprehend the entire mobile stroke unit workflow, and register a mobile stroke unit patient from the Mobile Stroke Unit Telehealth tab on the FirstNet tracking board. In March, Stony Brook Medicine will launch Long Island's first 2 mobile stroke units. These state-of-the-art units are designed to provide specialized, life-saving care to people within the critical moments of stroke before they even get to the hospital. When someone has a stroke, the brain cannot get the blood and oxygen it needs, and therefore brain cells die. The faster blood can be restored to the brain, the more likely a person can have a full recovery. Each mobile stroke unit is essentially a mobile stroke emergency room with telehealth capability to Stony Brook University Hospital. Each unit contains a crew of stroke first responders, including a critical care nurse, paramedic, emergency medical technician or EMT, and computed tomography (CT) technologist. Medications including the clot-busting agent TPA, brain imaging equipment, including a CT scanner that can perform both a standard head CT scan as well as a CT scan angiogram, and Stony Brook Medicine Telehealth's teleradiology and teleneurology services, which enable Stony Brook emergency physicians and neurologists to instantly see and examine a person via video conferencing and advise the mobile stroke unit's crew en route to the hospital. The mobile stroke units will be available 7 days a week from 8 a.m. to 8 p.m., which is the window of time when most stroke calls are received. One will be strategically placed at a base station near exit 57 on the westbound side of the Long Island Expressway, and the other will be stationed similarly near exit 68. These 2 locations provide rapid north-south and east-west access. Patient access will have an integral role in the registration process for those patients served by the mobile stroke unit. Let's take a look at the workflow. Steps 1 through 4 of the mobile stroke unit workflow will be completed by clinical staff. Step 1. Patient is quick encountered by nurse and mobile stroke unit or MSU team using PNT or MSU quick encounter conversation. Step 2. Patient is treated by medical staff in the mobile stroke unit. Step 3. MSU staff completes the MSU encounter update conversation in PM office. Step 4. MSU staff enters the depart date and time and discharge disposition. Once the discharge disposition is selected by the MSU team, completing the MSU encounter update conversation, an R will appear on the FirstNet tracking board. The remaining steps are to be completed by Patient Access staff. Step 5. Patient Access Call Center Mobile Unit staff proactively monitors the Mobile Stroke Unit Telehealth tab on the FirstNet tracking board. Once the discharge disposition is selected by the MSU team, completing the MSU encounter update conversation, an R will appear. Step 6. Patient Access Mobile Unit team hours are from 8 a.m. through 7 p.m., 7 days a week. During these hours, Patient Access representatives will register MSU patients using the Register Patient conversation as soon as possible within 48 hours of patient depart. Step 7. Patient Access representatives will obtain registration information to complete the Register Patient conversation, including contacting the patient's family using contact information provided in MSU conversation as possible, contacting the transfer hospital found in the MSU conversation, searching for prior registrations in Cerner, IDX, Envision, etc., and reviewing the EMS run sheet, EPCR, that was scanned into the patient's electronic medical record, or EMR. Step 8. Within 48 hours of documentation of patient depart, Patient Access, using the Patient Access discharge conversation through FirstNet, retroactively discharges the patient using the depart date and time encountered by the MSU team in the MSU Encounter Update conversation. If the patient is admitted to Stony Brook University Hospital or is brought to our emergency department, a new encounter would be created and standard registration procedures would be followed. Now that you know the steps, let's walk through exactly how this would look for a patient access representative. Launch FirstNet by clicking the FirstNet icon in the Cerner applications. A pop-up will appear stating, "You are currently listed as an unavailable provider. Do you want to be checked in as an available provider?" Click No. The FirstNet tracking board will appear. Click the Mobile Stroke Unit Telehealth tab. This tab is taking you to register the patient outside of the Stony Brook University Hospital system. This will not be a Stony Brook encounter. The list of mobile stroke patients will appear. When the R appears in the Events column, that indicates that the MSU Encounter Update conversation has been completed by the MSU staff. In order to get the information needed to complete the registration, click the MSU Encounter Update icon located here. The MSU Encounter Update conversation will open. Here, you will retrieve the phone number to contact the patient's family or the facility the patient was taken to. You will also need to note the MSU depart date and MSU depart time. Within this conversation, you will also need to check if the EMT information at the bottom is complete. The patient can only be discharged if this information is filled in. Once you have noted all of the necessary information from this conversation, you may click the Cancel button to return to FirstNet. You will see the pop-up, "Cancel this conversation." Any unsaved changes or additions will be lost. Click Yes. The Patient Search pop-up box will appear. Enter in the encounter number for the patient from the Mobile Stroke Unit Telehealth tab and click Search. Select the Mobile Stroke Encounter and click OK. The Register Patient conversation will open. Please note that patient positively identified as well as e-signatures obtained automatically defaulted to No. Do not change these. Click the drop-down for Financial Clearance. Select Cleared. If the patient was brought to another facility, the patient access representative will use the contact number found in the MSU Encounter Update conversation to get the information necessary to register the patient. In addition, the patient access representative will search for prior Stony Brook registrations to retrieve the information. If there is no contact number available or nobody to supply the information, the patient access representative should reach out to the facility the patient was brought to in order to retrieve the necessary information. If the patient was brought to the Stony Brook University Emergency Department, they will have a new encounter entered into the Stony Brook system. The patient access representative that is completing the register patient conversation for the MSU encounter can obtain the registration information from the new ED encounter. Click the Encounter Information tab. Notice that the information here has been pre-filled. Although until further notice the patient is not being billed for this service, for informational purposes, the patient access representative should reach out to retrieve any insurance information for the patient. If all avenues have been exhausted and no insurance information can be obtained, the patient should be listed as self-pay. Once all information has been obtained, click Complete. After successfully registering the MSU patient, the patient access representative is responsible to discharge the patient. This must be done within 48 hours of the MSU depart date and depart time located in the MSU Encounter Update conversation. Before the patient is discharged, you must ensure the EMT information is complete in the MSU Encounter Update conversation, as seen here. If that information is complete and the patient has been successfully registered, you may continue on to discharge the patient. Let's review how that is done. Make sure you have the correct patient selected and then click the Discharge Encounter icon. Enter in the discharge date. This should be the same date that is listed as the depart date in the MSU Encounter Update conversation. Enter in the discharge time. This should be the same time that is listed as the depart time in the MSU Encounter Update conversation. Click OK. The patient has automatically been removed from the Mobile Stroke Unit Telehealth tab on the FirstNet tracking board. Some patients may be brought to Stony Brook University Hospital in the Mobile Stroke Unit. If they are brought here, the patient will still be discharged from the MSU Encounter. However, they will be encountered in the standard way for their visit to Stony Brook University Hospital. This concludes the e-learning on Mobile Stroke Unit. Thank you from the Patient Access Department. See you at the next lesson.